Aortic aneurysm. To start off simple, your aorta is a structure in your body that carries blood from your heart to the rest of your entire body. And in your case, your aortic wall has become weaker. This is because the walls of your aorta are expanding due to the continuous and constant pressure of blood flowing against it. This is then what causes your aorta to enlarge and bulge out, looking like a balloon. In the medical world, this is what we call an aortic aneurysm. The anatomical change to your abnormal heart, in other words, your injured heart, is that the wall of your aorta, which is distal, meaning below your heart, begins to enlarge and bulge out of your aorta. Due to this change in anatomy, the consequences include the forcing of the blood against your aorta. Because the blood is being forced against your aorta, this has the capability to split the multiple layers of your artery wall. This, unfortunately, allows blood to possibly leak in between those layers. This will further lead to bleeding throughout the rest of your body. Now, your symptoms. You have the very basic and common symptoms of an aortic aneurysm. This includes continuous pain in your abdomen, meaning your stomach and belly, chest and back pain, low blood pressure, shortness of breath, trouble swallowing, or a pulse or something like that feels like a heartbeat right by your belly button. As you can see in the diagram, on the left side, we have what a normal, perfectly healthy aorta looks like. And on the right side is what the person's aorta looks like when diagnosed with an aortic aneurysm. On the right side is what your aorta looks like. Because your aneurysm is very small and minimal, we recommend that we run a few tests to make sure there is no serious damage to your aorta or heart, and then we can prescribe some medication to keep it that way. But that doesn't assure us that in the future we won't have to do surgery. The tests we would like to run right now are an ECG, CT, and MRI. Those are just abbreviated for an echocardiogram, computed tomography, and a magnetic resonance imaging. The ECG is a device that allows us to capture pictures of your heart going into your aorta in real time. The ECG will show us how well your heart chambers and valves are working. After we run the ECG, we would like to follow up with a CT. A CT is a machine and technique we use that simply is an X-ray, but it takes sectional photos of your body. This is the test that will decide the size and shape of your aneurysm and how we will determine we go about the rest of this process and how we should take the proper precautions we need to eliminate this aneurysm. And the final test we would like to run is an MRI. An MRI is a machine that uses radio waves to take accurate photos of your body. These pictures will help us determine your aneurysm size and location in your aorta. And after we run these tests and get the results, we will determine your treatment. But looking at your charts and stats, my guess is we will need to see you in about 6-7 months for a follow-up to examine the size of your aneurysm. But for the meantime, we're just going to prescribe you this medication called statins. This medication is used to lower blood pressure, cholesterol, reduce blockages in your arteries, and reduce the risk of aneurysm complications, all of which you have or have the possibility of getting. With this being said, the outcomes are pretty good. If we treat and maintain your aneurysm correctly and take proper precautions, then you will have a long-term survival rate. But if we don't keep an eye on this, then death and emergency surgery is not out of the equation. But that's only if we presume to be reckless. But that's about it. If you have any questions, feel free to ask and don't hesitate. I believe you have an ECG in about an hour, so I will send in my nurse to get you prepped and ready for that. Have a nice day.